Good day, this is Dr. Devesa, and I would like to share with you information about autism spectrum disorder. Before we start, I would like to emphasize that someone with autism spectrum disorder must not be called autistic because it's a discriminatory remark. Okay. And then, what are the manifestations of someone with ASD? Of course, as an infant, you must be vigilant to observe if that infant does the imitative play wherein he or she follows what you do. Like, for example, tongue out. So that infant will follow doing that. However, someone with ASD would not be able to do that because of the absence of mirror neurons. So they cannot do imitative play. Next would be delayed speech. Okay. So if an infant usually is expected to say mama, dada, or papa at 11 months, usually for someone with SD, it can be delayed. Like, for example, 1 year and 5 months, or 1 year and even 2 years old. They have difficulty talking, or they have delayed speech. They cannot talk or respond to your demands, or if ever you call him by his or her name, she or he does not respond as well. Okay, aside from that, they're very sensitive to noises. What is also very observable was that that child, or like for example a toddler or preschooler, cannot play with other children, or they prefer to have a solitary play, to play alone, and then make lines, or for example repetitive, or um, they want to have a routine, repetitive behavior or activities, and they're very irritable, especially if it's not a routine activity, or there are for example changes in their routine schedule. So they are easily stressed, of course, and you can observe that they behave differently from other children, and they have really difficulty socializing. Like, for example, that's the solitary play. They do solitary play, and they cannot converse with other children or talk to other children aside from their delayed speech. Okay, they are also sensitive to other activities or other